Good morning, everyone.
Good morning.
Can you hear me, I think? My voice projects anyway, but they told me I had to wear a mic, so I'll be compliant. I was asked to come here today to talk about my organization and a little bit about myself. But before I do that, I wanted to give a backdrop in terms of healthcare today and how my organization is positioned to really respond to the changing tide that we're seeing in healthcare. And when they asked me for a title of my talk today, as you can see, I titled it From the Expected to the Exceptional. And what I will say to you today is, you know, people expect you to do certain things. They expect you to be and do things that maybe the normal person would do. But the only thing that holds you back from achieving the exceptional is ourselves. And I want to use our example for you to show that while people may tell you no, maybe people will tell you you can't achieve certain things, that doesn't mean you can't do it. And we are a prime example of why I believe that. So I am with Hamilton Health Center. I'll tell you about the organization. But first, let me talk about where we in the United States receive our health services. So when you think of healthcare, generally you'll think of a hospital, right? You know, there's in the news all the time, hospitals, and quite honestly, we're getting a smaller and smaller number of hospitals because they're merging. They're becoming these huge, huge health systems. You also think of private doctor's offices, and you know, most of us have what they call a primary care physician. That's what everybody wants us to have, is a primary care physician. When I was growing up, most of the doctors were in their own private practices. They were with group practices. But today, only 1 in 4 doctors, only 1 in 4 physicians have their own practices. The rest are owned by hospital systems. And that has changed dramatically over the last 5 years. So we have the hospitals and the emergency rooms, we have these private doctors' offices, and now we have these urgent care centers, these Insta-clinics that may be in a grocery store. Some of you may have seen them in the Giant, or I don't know whether Weiss has them, but I know the Giant has them right there. The CVS has them. So you're seeing these Insta-clinics pop up everywhere for convenience. So if you're sick, you pop in unannounced and get served for the problem that you have, right? And then we have community health centers, which is the organizations that I represent. And community health centers are really group practices. They're what the traditional doctor's offices are. We are an independent organization, not-for-profit company. We are the part of the largest network of primary health care providers in the country that are not under a hospital system. So I want you to keep in mind those aspects. Where is the most expensive level of care that you can go to? Anybody? Emergency room. We're a country that overuses the emergency room like no other place. People think of going to, I'm sick, I got to go to the emergency room. And we'll think nothing about sitting for 4, 5, 6 hours in an emergency room just to get that immediate problem taken place. And because those are so overused and such a high cost, that's why urgent care centers really grew up, so that there's another alternative for people to go to rather than an emergency room. And most of them are cash and carry. You know, you don't have to have insurance. You can walk in, and as long as you have the money to pay for that visit, you're good to go. But they're not going to give you, usually they're not giving you the physical exams. They're not going to follow your disease states. They're not going to have your history. You pop in, you get that problem taken care of, and you're out. So I want to show you that in the United States, these are, if you notice these countries, these are most of the industrial countries in the world. The United States spends more per person on health care than any other country. If you look at it, we're more than half of the United Kingdom. Japan, France, you can see theirs are at 4,000 and some a person. The average is $5,100 per person, but in the United States we spend a whopping $10,348 per person on health care per year. Now, look at this comparison. Keep in mind what you see here, and let's go to the next one. So in life expectancy, you'd think that if I spend that much in health care, my life expectancy should be much greater than any other country, right? Look at that. We have the lowest life expectancy of all the countries that were on the prior screen. So while we spend more than half than most countries spend in health care, we have the lowest life expectancy than any other country. So let's look at Japan. Japan has the highest, right? Let me go back to that screen. Here's Japan at $4,500 per person. Does that make sense? Does anybody want to guess why there's such a discrepancy? So while we call our system a healthcare system, we're really a sick system, right? We didn't invest in prevention. We didn't invest in, how do I stay healthy? We tend to go to the doctor when we're sick. Most of our diseases are the highest rates of death are caused by diabetes, heart disease, cancer. Those are the highest rates of disease and death in our country. So diet, exercise, a lot of things are really behavior driven. But you look at it from an educational perspective as opposed to, and those countries do it from an educational perspective, and in all those countries, everyone has access to health care. The basic premise in those countries is that health care is a right for all people, not just some of the people. In this country, we rely on employers to give us insurance for the most part. So if tomorrow I was unemployed, I'd be uninsured. Correct? Now, a lot of you are under 26, so a lot of you may be on the health insurance from your parents, right? How many are covered by their parents? Right. Do you know why you can get coverage by your parents? Anybody? Yes. Right, they call it Obamacare, but it's really the Affordable Care Act. And that's been this whole big debate. Everybody wants to call it Obamacare, and we get on two polarized sides. It's the Affordable Care Act. There's a lot of elements of that Affordable Care Act that are huge, including covering most of you in this room on your parents' insurance. Because if that wasn't in existence before, once you graduated from high school, you were done. You were on your own. You didn't have insurance before the Affordable Care Act. So that's one big aspect that it brought to the table for a lot of us. But if your parents aren't employed, guess what? You don't have health insurance. Neither would they. So universal health care coverage came along with the Affordable Care Act, that for many people, if I became unemployed, now I can access insurance. Now, is it the best insurance, and do we know how to navigate it? Absolutely not. Are there things that need to be changed and fixed? Absolutely. But should it be thrown out with the bathwater? No. And I come at this from a perspective of one that delivers health care, one whose taxes pay for all those overuse of the emergency room, and if any of you work, you're helping to pay for that too if people overuse the emergency room. So the question and what's been happening with healthcare over these last, especially 5 years, and where it's heading now, is that we're all becoming more educated consumers. We're being asked very quickly to learn healthcare, not just 101, but up to the 300 and 400 level courses of how should I manage my own healthcare? How do I pick a primary healthcare provider? How do I pick my specialist if I need an operation? The healthcare industry today is saying to you, you need to look and examine. Do I get the same level of care? What's the cost in one institution versus another? If you talk to your parents, they're going to tell you 5 years ago, nobody was even thinking about this, because that's not the way we consumed healthcare services in this country. But it's changing very rapidly because it's costing this country too much per person on healthcare and not getting the results that we want. So our life expectancy, with all the technology, with everything else that we have at our fingertips in this country, our life expectancy should be going up. We shouldn't be below Sweden and France and Australia and all the rest of these countries. We should be leading the pack. But that has not happened in this country. And so now the policymakers, the regulators, are all trying to figure out, how do I turn this system back on the right track? And as consumers, they're putting a lot of burden on each and every one of us. So, for the rest of my talk, I'm going to talk about Hamilton Health Center and how we're trying to help change the dynamics. And our organization is really focused on trying to change the dynamics and how people use healthcare by some of the most vulnerable citizens we have in this country. Federally qualified health centers are all around the country. We're the only one in Dauphin County. We're located in the city of Harrisburg on South 17th Street. So if you know anything about the city, Front Street's where the river is, and then the street numbers go up. And so we're 17 blocks from the river, and we're on the south side of the city. So Market Street is sort of the dividing north and south lines. We're on the south side. And that's where we have a lot of low-income populations. So I've used the term federally qualified health center, and I'll use that interchangeably with community health centers. So what are federally qualified health centers? We are not-for-profit organizations. We are all outpatient. You would not find us doing any type of inpatient care. We get our designation from the federal government. So I'm not regulated by the state. I'm not licensed by the health department. I'm regulated by the federal government because I receive certain funding from them and I get certain advantages from them. Every 3 years they come in with a team of people and they examine us from top to bottom, and then they go away, and I have guidelines that I have to operate by. But I'm managed by a board of directors. 51% have to be users of my service. So they govern the organization, not a government entity. It is governed by a community board. We must be situated in what's termed medically underserved areas. And there's a formula that's used to get those designations. And if I have a high enough score, I get added advantage. So medically underserved areas are measured by the level of poverty, the lack of insurance, the lack of access to medical care, and people's poor health status. Our mission, the mission of all of the community health centers, is really to help improve the lives of individuals that it serves, regardless of a person's income, insurance, or health status. We provide a variety of services. It's mandated that there's a core set of services: medical, dental, behavioral. So there's a comprehensive view of healthcare, which includes prevention and access to treatment. Community health centers, or FQHCs, serves 1 in 12 residents in the United States. But I can tell you that 2 years ago, 3 years ago, even today, if I asked you, how many of you know about Hamilton Health Center or some organization that's a community health center? 1, 2. But yet we serve 1 in 12 residents in the country. But we only have 2 people in this room that even know about us. Right? So we're a hidden secret in the whole healthcare arena. It's only been recent that I've been really advocating for schools, universities, to put in their curriculum the aspect that there is something beyond a hospital. Because what I'm going to tell you is that because hospitals are shrinking, the number of jobs in hospital systems are shrinking. I'll give you a good example. Pinnacle, UPMC and Pinnacle. How many have been hearing about that on the news and advertising? And between that and Highmark, Hershey, right? You see those 2 on TV all over the place now, right? Well, before those were the Hershey and Highmark companionship is a different relationship than UPMC and Pinnacle. Over the last year, in 2017, Pennsylvania led the country in hospital mergers. So in just 1 year, Pinnacle, and this was very orchestrated, so all of you are business majors, right? Mm-hmm. So there was a very orchestrated stance and plan to merge hospitals. So Pinnacle bought up 5 hospitals in our region. UPMC is in Pittsburgh, right? Nobody knew UPMC was in this mix. So Pinnacle bought up 5 hospitals. After they finished that merger of those 5 hospitals, UPMC came and bought Pinnacle. So we went from 7 hospitals to 1. So guess what I don't need when I went from 7 to 1? I don't need all that administrative structure. I don't need HR, and from 7 that had 7 HR departments, shrunk to 1. I don't need all of my billing people. I don't need all of my business people because I brought it in centrally. And UPMC in Pittsburgh has all of that in its infrastructure. So as you think about careers, think about where's the market going? Where's your opportunities going to be? Don't put your thoughts in one basket. I'm not saying put it in any of these. I'm just saying make sure you're looking on the horizon and doing your homework. So with ours, we serve the 1 in 12 residents. And in Pennsylvania, there's 47 federally qualified health centers with over 200 sites in 64 of our 67 counties. So I'll give you a little bit of history of Hamilton Health Center. We were established back in 1969. This trailer that you see over there in that corner, that's where it got its start. The church that you see, that building, was renovated and it moved from the trailer into that building in 72. Hamilton got its designation as a federally qualified in 72 as well. And until we moved into the new building, which I'll talk about in 2012, we operated out of that building. When we outgrew that building, we just went and opened up smaller sites. We have 2 school sites, we have different small sites around the city. And in that building, we operated pediatrics, adult medicine, women's health. They were all in that building. When we did expand between 1993 and 2007, we opened the Walnut Street was dental and administration. There were 2 school sites, one in each end of the city. On one, the Foo School was a family practice site, and we also did WIC services there. And in the Downey School site, we did pediatrics, medical, dental, and WIC. So our approach was to try to bring services as close to individuals as we could, because keep in mind, our premise was we wanted to serve, and our mission was to serve primarily low-income people. So to bring that and eliminate barriers was really important. This is an array of services that we offer today. You'll see that we serve the entire family. You'll see that the most talked about issue today in terms of substance abuse is opioid addiction. And we're one of the 45 centers of excellence that Governor Wolf designated in 2017. First of next month, we'll open our vision service. So we will begin to offer vision care to both children and adults. And I'll give you an idea of how many patients that we serve. So 1999, I joined the organization in 2000. So in 1999, we were serving 12,000 patients. The end of last year, we are serving 28,500 patients. What does that equate to in terms of visits? These are unique individuals. So we did 97,000 visits in 2017. So a person may go to the doctor more than once or go to the dentist more than once. Those all count as the visits. So we did 97,000 visits. So in terms of a healthcare provider, we are the second largest. Hospitals, of course, have the largest. But even when you think about the hospitals and their primary care practices, those individuals, those docs, primarily are in the suburban areas of cities. They serve primarily the insured population. We serve the insured, we serve the uninsured. We take all insurances. So I have Highmark, I have Capital Blue Cross, I have Health America, I have all of the insurances, but the primary insurance that we take is medical assistance. So in 2005, my board decided to take a different strategic direction. When I was introduced, if you heard, it said when I joined the organization in 2000, we were close to financial insolvency. In fact, we were $2 million, it had a $2 million deficit. When I joined the organization, the staff that were there, we had payday, and I'd say, please don't cash your check today. Hold it until Monday. We paid Friday, I'd ask you to hold it till Monday so I could get some more revenue in my door to be able to make that check good. So through 2000 to 2005, we continued to try to strengthen the financial stability of that organization, get us out of that deficit situation, get us to a point where we could look to the future and what we needed to do. So in 2005, rather than just taking a look at those small facilities that you saw that I gave you the pictures of, our board took a very, very bold step. And what they decided to do was first do a community assessment. We may have great ideas, but you want to vet those ideas. You want to determine whether your idea is viable. So in my industry, the way you do that is you go and you do community assessments. Is there a need for us to grow? Is there support from community for us to grow? And so we did that in 2006, and we used interviews of stakeholders. We went and got a consultant to help us. They did those interviews. They looked at secondary data sources from the health department, from census tract, from the census, all sorts of information. And what they came away with is, yes, there is definitely a need for us to grow. There's definitely a need for us to expand services. But in order to do that, and since our mission was, we have a niche in our marketplace, we aren't really competitors to the hospital systems. We actually support the hospital systems by serving a population that they lose money on. So there's a very specific business model that we operate in. The idea was, let's create a medical mall. Let's bring as many services under one roof as possible so people don't have to worry about navigating the system. The bus situation here, public transportation is not good. If you ever try to take buses in the area, it could take you forever to get from point A. From here downtown in Harrisburg, I can't even imagine how many hours it would take to try to navigate that. We're not like a Philadelphia or a Pittsburgh. So if people can get to us, we want them to be able to get as many services as possible. We have a very diverse community with a lot of different languages spoken. And language is extremely important. If you're trying to communicate your health problem to somebody and they don't understand what you're saying, you're lost. So in our industry, it was really important to try to coalesce as many services under one roof as possible. From 2006 to 2010, we went about trying to find the funding for our project. But if you keep in mind, between 2007 and 2009, there was a financial recession in this country. The banks really became tight and very restrictive on who they would loan money to. And in order for us to take on this project, we needed financial backing. The way that we got that financial backing was through a bank. If they looked at all of our financial statements, most of the banks turned us down. But there was one bank in this community that took us on. They took us on because they believed in our mission, and they believed in what we had done with the organization up to that point. And as I begin to talk about, and when I get to, talk about myself, what I will tell you, as you develop your careers, it's going to be important that you develop relationships. Serve on boards of directors of different organizations. It could be the United Way. It could be other nonprofit organization. Find a way for you to develop your relationships, because it was through my relationship on a board of directors with a bank president, that he then had sent his team to look at our project, and they're the ones who financed us. Had I not had a relationship with that banking institution through a formal board of directors, I don't think we would have ever gotten them to take a look at us. So it's important for you to network, for you to develop professional relationships, and that can be through, there's an organization called the Harrisburg Young Professionals, and there's one over in Cumberland County, Young Professionals. There's the Chambers of Commerce. It's important as you develop your careers, wherever you go, that you connect up with some of the professional organizations. So I sort of digressed a little bit, but we finally got our financing. We started construction in 2010. The cost of our project was $16.5 million. Nobody believed in that project. Everyone thought we should think small. Go back to the model that we had before. We had smaller buildings. To do a small building, maybe $1 million, $2 million. This was $16.5 million for just phase one. But even though people kept saying, think small, think smaller, you're biting off too much, you shouldn't do this, you're a community-based organization, we kept moving forward. We believed in our mission. We believed in the vision for this new model of care. So in September of 2012, we opened that phase 1 of the project. And in less than a year, we thought after that phase 1 that at least 5, maybe even 10 years, that would suffice. We had more room in the building. We only built out 50,000 square feet of a 67,000 square foot building. But we thought, oh, this can last us. This is so much more space than we ever had. But in less than a year, people were coming from everywhere for services. They were crossing that Susquehanna River from Cumberland County coming in. They were coming from Lebanon County. They were coming from Upper Dauphin County. They were coming from everywhere because the need was so great. And so we decided we better start thinking about phase 2, building out the rest of the building. But we couldn't take on any more debt. We had already committed ourselves for a 30-year mortgage. So the way we did that was to go and take on a capital campaign. And in that capital campaign, we walked people through the building to show them what we had accomplished, to show them how much of a need there was, how busy we were. And in less than 1 year in this community, we raised $8 million from the private sector. So in total, the project became a $23.5 million project. We opened phase 2 in January of 2012. This type of development was unheard of. It went from what people expected to the exceptional. So I'll show you what we took on. So this is what our building looked like when we took it on. It's a boarded up building in South Allison Hill. It created such blight in the community. It was a boarded up warehouse. It was also a brownfield. So a brownfield is where there was industrial use of property sometime in the past. And when they closed up the industrial property, an automotive site, which it was, it left behind that top picture. The state came and helped clean it up. We didn't have to pay for that cleanup. The state took that on, so we had some public dollars in there to do that. The investigative work began in 2004, so even before we took on the project, they were in there trying to clean up that space. Brownfields can then be turned into public use. This is what it looked like inside, the picture to your left. It was an open area, but that's what it looked like. To the right was the Brownfield Remediation. They had to take out any contaminated soils, truck it away. This is what it looks like today. So on your left is a waiting area for children and women in a nutrition program that we have in the building. To the right is a reception desk where people come in and are greeted. This is registration areas back in our medical and dental departments. This is the dental department, where we have 12 dental operatories. We employ 7 dentists, 3 hygienists. Those are some of the signages for the services we offer. That's what a medical exam room looks like. We have people that walk in the building. We have people that, oh, I did that right, but how do I get this back? Let's see. How do I get that? Oh, that makes sense. Thank you. Yep. We have people that come in and they tell us dentists that come in that tell us their own private dental offices don't look as nice as this. Everything is electronic. Everything is interconnected. So if you're in the dental department and you're getting served and you're also my medical patient, I know whether you have diabetes or hypertension because my electronic record crosses over from one to the other. One of the things that makes us unique, you'll never find another medical provider that does this full array of service. You don't find hospitals generally that do dentistry. You don't find hospitals then that also do a number of the outreach that we do. We have a full service pharmacy in the building, so you don't have to go anywhere to get your prescriptions filled. You come in, you can see the doctor, they electronically prescribe over to the pharmacy, and then the pharmacy can fill your prescription. You don't have to use that pharmacy. They'll ask you, where do you want your prescriptions to go? And if you tell them, I use a pharmacy down in E-Town, they electronically prescribe it down here to a pharmacy in E-Town. So it's not restricted where you can go, but for convenience, we do have it right there in the building. So after the renovation, that's what that building that you saw, that boarded up building, that's what that building looks like today. So many people would have torn it down, started from scratch. What we like to do is build up the community and safeguard what we have. That building, if you can recall, was brick. There was nothing wrong with the brick. It was a very solid building. And all that we did, that's still the same brick. In many cases, we did put a new facade in some of the areas, but it's really the same building. So beyond 2015, people would say, well, you're done, you've done enough. But beyond 2015, when we opened up, and when we finished opening up, and I told you that there was a 67,000 square foot building. We owned 5 acres of land. We added a second floor. So when we ended up, our building today is 87,000 square feet of space. Second floor houses social services and administration. But beyond that, in 2017, we opened our first suburban practice out near Union Deposit, where Community General Hospital is. It's a family practice site. As I indicated earlier, the first of next month, we'll be opening Vision. And in 2018, this year, in May, we'll be opening our first rural site in Perry County. In 2017, we accomplished some major hurdles. We became accredited by the Joint Commission. If anyone knows, Joint Commission is the gold seal for healthcare, for high quality. We aren't mandated to go Joint Commission like hospitals are, but we chose to do it. Why? Because a lot of times people think of community health centers as poor people's clinics. I hate that term. We are a high-quality health facility, and so it meant a lot to us to get that gold seal. And so we use that gold seal on everything we have. We are accredited for ambulatory care, and we also are certified as a patient-centered medical home. We are a major employer in the city. We have 240 employees. For 2018, we're on track to actually go to 267. I employ all of the doctors, the dentists, the nurses, billing. I have a CFO, a COO. I have everything that you think in a corporate structure because we are a business. Many times people who operate not-for-profit organizations think about we have a mission and we are mission-driven. But a long time ago, someone told me, no margin, no mission. So if I don't make money, I'm not going to be able to do all the things that we talked about. So regardless of the environment that you go into, it's always about a business. Not-for-profit organizations can make a profit. It's what we do with that profit. So in a for-profit company, a lot of the profits you share back to your shareholders, right? But in a not-for-profit, you reinvest it back into the organization and services. So when I talked about our expansions, that's what we do. One of the things that sets us apart from other nonprofits is that my revenue source is insurance payments. I don't go out every year and ask for donations. A lot of not-for-profit organizations have to do that because their revenue streams are grants and they're totally dependent on grants. Successful organizations diversify your funding streams so that you're not reliant on any one source. So if something happens and that's gone, you have other sources of revenue to support your company. When I go out and solicit funds from donors, which I told you for phase 2 we did, and I was able to raise $8 million in less than a year, it's because I told them I won't be back to you to ask for more money next year. If you give me this for this project, we will be self-sustaining. We will make this work. We will only come if we have a new project. So when I went and we planned for Perry County, I went back out to a different donor market who were very supportive of Perry, and I asked them for funds. We raised $450,000 in 6 months. Again, I told them, I won't be back. We will make this work. When you go into whatever profession you're in, your word is your bond. Integrity means everything. If you tell someone that you're going to do something, do it. That will go a long way in them trusting you, because that's what business is based on, trust. We are an economic catalyst for the South Allison Hill corridor. I not only now own 5 acres of land, I've now bought 4 more acres of land down in South Allison Hill. Why am I buying up property? Because I want to control who comes into that neighborhood. I want us to build up and have grocery stores and restaurants for the employees. I don't want to take a risk that a bar is going to come and open up next door to me. I want safe environment for our employees and our patients. And that's why people are coming from all over. We have very large parking lots, and it makes it very easy for them to get in and out. So from a financial stability standpoint, as I told you when I started, we had a $2 million deficit. Today we have over $1 million in net assets. 2017, I ended the fiscal year with a profit of $1 million. And again, that money goes right back into services, goes right back into paying higher salaries, because I have to compete in my market with everybody else. I can't quite compete with the hospital systems, but I have some other advantages. I can offer loan repayment to my doctors, my nurse practitioners. That's because the federal government and state government offer loan repayment if you work in an underserved area. So that's a huge incentive if you come out of school and somebody's going to offer to pay some of your loans back. My malpractice insurance is paid by the federal government. So that's a huge piece that I don't have to cover, and that my workforce doesn't have to worry about malpractice insurance. So there are some benefits of coming to work for a company such as ours. So my career track, how did I get here? Well, I started in state government. I came out of college. I worked for 1 year in Pittsburgh and then got recruited to come to Harrisburg at the lowest rung of the professional ladder. Now, oftentimes people say, oh, you should be making all this money when you come out of school. Well, I didn't have a whole lot of experience, but I got an opportunity to work in state government. And I stayed in state government and worked my way from one position to the next position to the next position. I invested my time and energy in learning what I needed to learn and got recognized by people who were higher than me, who helped to mentor me to take the next step in my professional career. So my last 8 years in state government, I went from the lowest rung of a professional ladder to being appointed Deputy Secretary of the Pennsylvania Department of Health by the Governor of Pennsylvania. It takes time, it takes commitment, it takes someone seeing that you are committed and have the opportunity to help move you forward. In a position like mine, when the governor leaves, you leave. You know, I could have taken a step backwards, but a deputy secretary and the secretaries of the departments leave with the administration. I wasn't political, let me say that. A lot of times people say, well, you have to be political to get in those positions. I wasn't political. I just paid my dues. And I let people know that I'm looking for that opportunity to keep moving up. So when that happened, when the governor left and I had to leave, I was recruited by a for-profit company down in Silver Spring, Maryland. And I went with that company and did consulting work around the country. It was a great experience because up to that point I only knew Pennsylvania, but I had the opportunity to see how state governments work and provide some expertise that I had developed to help them to navigate some of the policy situations they were in. It just so happened I had a young child at that time. My husband was here and I was commuting down to Silver Spring, and you know, children can make you feel really guilty. So after a couple years, I stopped that. My husband and I opened our own business, so I became an entrepreneur. And then I was asked to serve on the board for this organization, Hamilton Health Center. When they went into the financial decline, they said, would you step down off the board and go inside temporarily to run it? And I thought, why should I do that? I've had this really great career. Why would I want to go into a troubling organization? Why would I want to jeopardize my reputation? But I believed in its mission. And so I took that journey. It was only supposed to be temporarily. But once I got inside, I found my passion. Passion is everything. If you have passion for what you do, it's not just a job. It's not just I get up and go to work every day. It's that I get up, I go to work every day, and I see that I'm helping people every single day. I've been able to grow an organization from 50-some people to over 240 people. And we work as a team. So it's fun. It's challenging, but it's fun. Those positions helped me to get ready for where I am today. And so, to end up, so the recommendations for a successful career, you're going to have to take calculated risks. Everything's not a guarantee. No, a calculated risk, not just, a whimsical risk. Do your homework. You have an idea, vet it. Find out, could this work? Don't let people dissuade you from searching out your passion, from doing what you really want to do. The first time out, first job, second jobs, it may not be what you want to do, but it will help to set the path, give you experience. It's all about experience, learning. It's a lifelong learning, but everything that you do, take it in and see where that opportunity could take you. As I indicated earlier, build your relationships. Serve on boards. Go through some leadership training. Build your credibility and trust, regardless of where you are. As I said earlier, if I tell you something and I give you my word, I'm going to do it, I will follow through. If I can't, I'm going to come to you and I'm going to say, you know, I thought we could do X, Y, Z, but I see that that's not going to happen. Maybe we can do something else. But I'm not going to abandon you if I give you my word. And as I indicated, find your passion. If we had only strived to accomplish what people expected us to do, we never would have been here today where we are and where we think we're going and the vision's taking us. Everybody's not a visionary, and that's not a problem. Sometimes somebody else has the vision, and it takes the team to bring it to fruition. So it doesn't always have to be your idea, because you can contribute to one idea and make it even better, make it even be more successful. But whatever you decide to do, don't let somebody else dictate or tell you you can't do it. Believe in yourself, because only you can limit yourself. So thank you. Anybody have questions? I don't know if we have time for questions.
Yeah, we got time for a couple questions. Yeah.
Yes.
When did you realize that your position was your passion in healthcare? Did you realize that when you were in the governor position, the deputy secretary, or at what point did you see yourself going into your profession?
You know, I think that's a really good question. I'll tell people, you know, some people sit back and they get their goals. Tick, 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 tick. This is where I want to be. I didn't do that. You know, I looked and seized the opportunities as they came, and if it felt right for me and that door opened, because I have a very deep belief in that God directs my life. That's my personal belief, that God directs my life. So every stage that I needed to make a change, the door opened. I just positioned myself to be the best I was wherever I went. So when I came out of college, I was seeking jobs. I had a bachelor's degree in sociology, but I really didn't have work experience. So I picked up the phone and I was in Pittsburgh. I was, scouring the want pages, and I just so happened to find a job at a hospital in their drug treatment program. I didn't know a lot about drug treatment, but they offered me the position with training. So I took it, and I worked there for a year. And at the end of, actually it was about 15 months, my supervisor came to me and said, they're looking for a person in Harrisburg for a position, and I was called to find out if I knew of anybody who might be interested. It was a job, at that time it was the Governor's Council on Drug and Alcohol Abuse. And nothing was holding me back in Pittsburgh. I was single and, just ready for a career, and so I came, interviewed, and got that position. So that's how I got in government, in drug and alcohol. And I got to move up the ladder in drug and alcohol from the lowest rung of the professional ladder to a section chief, to a division director, to a bureau director. The next level up would be a deputy secretary. So I became the deputy secretary of drug and alcohol programs for the Commonwealth of Pennsylvania. But the secretary of health came along and wanted to reorganize the entire department. And so they did, and they said, well, you've been here, you've proven yourself. We're going to give you these other programs in addition to drug and alcohol. So that's how I got maternal and child health and, communicable disease. And so that's why I said each step prepared me, because I didn't have experience in maternal and child health, and now I have WIC, which I used to regulate. Now I have it as a service, so I understood it. So it's how those doors opened. While being a deputy secretary, I served on some boards down in Washington, D.C. for some of the federal agencies. So the consulting companies got to know me. And so when they knew I was leaving state government, they reached out and said, would you like to come and work for us? So to be honest with you, in terms of interviewing I cold interviewing, I think I've probably done 3 times in my whole career, because doors open because they saw that I was doing the best that I could and tried to, just achieve, the best where I was at the time. Anyone else? Well, thank you for your time. I really enjoyed being with you.